you nursing fans. Did I ever tell you how much I love nursing? I know it sounds a little crazy sometimes, like just a little bit, not a lot, a little bit. And some of you may not believe me, but it's true. I can't help it. It's like when you fall in love with that special guy or girl and you can't help but think about them and how happy they make you feel. Yep, that's me in nursing. My patients crack me up sometimes. I mean, you have to laugh and joke with your patients, right? It could be kind of overwhelming at work sometimes and you might want to pull out your hair. I'm not gonna lie, there have been times when I've went into the clean utility room and shed a tear or two, but that's between you and me. So it helps to laugh at your patients. I mean, laugh with your patients. Haha, I wish I could fake laugh. So I had this patient the other day and I was told that he was kind of demanding. So my first thought is, okay, Heather, just practice your personal assistant skills and you'll be just fine. So I go in there to introduce myself and he starts complaining about how hungry and thirsty he is because he's NPO for a procedure. And I told him, well, after the procedure, you can order everything on the menu. Later on, I walk into this room and he has his back towards me and I hear this paper like crinkling, you know, like he's opening a package of food or something. And I said, hey you, what are you eating? And he says, nothing. And I'm like, well, I hope you don't aspirate during your procedure because we only tell you not to eat anything for your own safety. So he continues to try to convince me that he wasn't eating anything except a piece of candy. And I'm like, well, whatever, I don't have time to argue with you. So he goes down for his test and when he comes back, the nurse's aide comes running to me and she's like, oh, he wants to leave against medical advice, like right now. And I was like, okay. And then occupational therapy comes and flags me down in the hallway and tells me the same exact thing. So I go in the room and I'm like, okay, what's going on? Why do you want to leave? And he says, oh, I was just kidding. They took it all seriously. It was so funny. And he starts laughing. I was like, okay, so I have a funny man for a patient, don't I? So numerous times I would go into the room to give him his medications and his bed would be empty and he would be in the bathroom. And I'm thinking, okay, this is kind of strange. He has a Foley catheter, so he obviously doesn't need to urinate. So I ask him, well, how come you're spending so much time in the bathroom? Are you having a lot of bowel movements? And he says, no. And I said, okay, well, why are you spending so much time in the bathroom then? And he's like, well, I just want some privacy and I want to be alone. Okay, that makes sense because that's exactly where I would go if I wanted some privacy. But what he really meant was, I'm in the bathroom because I'm drinking water out of the faucet, because I don't want to be compliant with my 1500 cc a day fluid restriction that the doctor ordered for me. So one time when I was giving him meds, I had his iron and I told him I was going to hang his iron IV. And he says, ew, it looks gross hanging up there on the pole and it's all brown. He's like, why do you leave it up there? And I said, well, I leave it up there because it's a punishment for drinking too much fluid. And he starts laughing. And then he tells me the story about how the night nurse told him that she wanted him to stay in bed because she didn't want him falling in the middle of the night. And as she's saying this, she trips over the computer cord. And he starts laughing, and then I'm laughing because he's busting up. So it's kind of fun joking and laughing with your patients. It's a crazy world out there sometimes, so laughing with your patients helps. Well, thanks for watching, everyone, and have a great day. I'll talk to you later, okay? Bye.